sorry, let me say at first, the total expenditure up until July 23rd is $10,570,000. That is broken down between the Health Services Authority of $6.8 million and Travel Cayman of $3.8 million. The remaining amount on page 2 of that document, you'll see is to be incurred between July 24th and December 2021. December 31st, 2021 is $17.9 million, giving us a total of $28 million, $28.5 million.
Honourable Leader of Opposition.
Yes, sir. I know. I get the picture here now. So, just looking at the 6.7 million for the HSC that's been incurred now to the 23rd of July. I guess start off by first asking why it's just getting to us now. I mean, we were here in July, and you know what clearly is the case is that this expenditure has already been incurred. Just curious to know why it's taken this long to get here. Why didn't it come to us in July?
Mr. Chairman,
Attorney General, sorry, Accountant General.
Mr. Chairman, through you. These expenditures have generously been funded by the Health Services Authority in the interim. We've been receiving billings from the Health Services Authority, but they've actually been footing the bill and paying Doctors Hospital for us on a monthly basis. As of right now, they're waiting. We got to a point now where it's quite large, and so they actually need the reimbursement. So it's at a breaking point where we actually need to replenish those funds to the Health Services Authority.
Honourable Leader of the Opposition.
I guess the figure does jump out to me as of what seems to be a very substantial amount being paid to Doctors Hospital for PCR testing. I mean, this schedule shows roughly 2.2 million up to 23rd of July, and a projected 2.7 million up to the end of the year. That's well north. That's about $5 million for the year in terms of COVID testing being paid to Doctors Hospital. Question as to I mean, they seem to be, undertaking a very substantial amount in terms of performing a substantial amount of the testing. Is there any particular reason for this? And in terms of what I don't have is a picture as to how many tests are they performing versus what the HSA is performing. I've got figures here as well for Health City, but that doesn't even really figure into the total. So just really understand what's the driver here.
Mr. Chairman, through you, thank you so much for the question, and I'll actually ask the CEO for the Health Services Authority. She has significantly more insight into the breakdown of how many tests are being conducted by doctors, Health City, and the Health Services Authority, as well as the costs and so on, if you'd like that information.
Okay. Yes.
Thank you.
Lizette, welcome to Finance Committee. Before responding, can you state your full name and title for the record, please? Thank you.
Good afternoon, Lizette Yearwood, Chief Executive Officer of the Health Services Authority. Mr. Chairman, the PCR testing is currently carried out according to government policy. And as you know, when the pandemic came about, we were not prepared to be able to respond to the PCR demand. And Doctors Hospital started testing in regards to the demand. So currently, the distribution of the PCR workload is divided in such a way that Doctors Hospital, they do the PCR exit testing for those persons at the government isolation facility, and HSA does those that are isolating at home. In addition to that, Doctors Hospital is also doing screening for individuals that are on the front line, and I believe screening for healthcare professionals as well.
Honorable Leader of the Opposition.
Okay, thank you. Through you, sir, to the CEO, can you tell, what do we actually pay them for these tests? Per test? Is there a fee per test that we pay?
That's correct. Doctors Hospital's fee is $150 per test.
Per test. And I know we use Health City as well. What are we paying them?
Health
Same?
Cities is $75 per test. Their equipment and their test is a little bit different than the PCR tests that HSA and Doctors Hospital do, and that is currently not used for exit testing. Their tests are used for travelers.
Okay.
Honorable Leader of the Opposition.
Yes, thank you, sir. And there is the $4.5 million here through to the 23rd of July for staffing costs. I mean, are these new employees of the HSA? Please explain to me how we get $4.5 million in staffing costs.
Mr. Chairman, through you, the staffing costs are to do a wide range of duties. There are individuals that that were brought on additionally in order to do certain things for the PCR testing, like, for example, admin duties in order to register persons for the vaccine. In addition to that, register persons for the PCR testing. But also, this is to pay for overtime duties as well for those individuals who have their regular job and are working after hours to do vaccination, PCR testing, contact tracing, and other such duties.
Okay. And can you give me some flavor then as to sort of numbers of people working doing this work?
To be honest, I would have to guess to give you a number, but suffice it to say that we have individuals who are working their regular jobs and then are going to, the vaccination sites and doing other duties as well. As you know, healthcare professionals aren't that easy to be able to recruit, so what we've had to do is to use the individuals who are currently working and they're being paid overtime.
Okay, so this then would mostly be overtime if I'm hearing you following through with your explanations.
Through you, Mr. Chairman. Yes, sir.
Okay.
Honorable Member for Georgetown North.
The figure of just under 2.7 million of PCR tests at Doctors Hospital and 220,000 for Health City. I don't know up to what date this reimbursement is on but the July through to December, that's quite a hefty figure, not having something to compare it to. Are we anticipating an increase in testing? And are we intend to continue to pay for everyone's tests, whether they're traveling on leisure or for whatever reason they want to get the test? Are we anticipating covering all those costs?
Mr. Chairman, through you, those projections are based on the current government policy, but obviously if the policy is to change, that figure could significantly change as well. One of the things that I know the Chief Medical Officer is doing in consultation with the Medical Officer of Health is actually looking at pricing or sourcing other kits. They're called lateral flow kits, which is basically a test kit that can be self-administered. And if that's the case, we project that there could be a reduction, because obviously with the borders reopening, we are anticipating larger number of individuals needed to be testing, and therefore we have to look at other options. But again, that's a policy decision, and we will respond accordingly.
Honorable Member for Red Bay.
Thank you, Mr. Chairman. Mr. Chairman, on the page dealing with expenditure projected between July and December, there is the number 4 item, which is just over $4 million for what's called episodic COVID testing. Can the minister explain for us what that means?
CEO.
Mr. Chairman, through you, that would be the PCR testing that is currently required for travelers and for persons who are exiting the island. And that, again, Mr. Chairman, through you, that is for all the facilities as well as the Health Services Authority.
Mr. Chairperson, I apologize. I can't follow along with the line of questioning without the document upon which the elected member for Prospect is.
Actually, sorry, we had distributed them. You
It's the
didn't-
government's document, so not my fault.
Elected member for Prospect, you're 100% right, sir. Sorry, Red Bay.
Same dog, puppy. Mr. Chairman, sorry.
Sorry, Honourable Member for Red Bay.
Mr. Chairman, what I'm trying to understand, I don't see a comparative entry on the other page, on the flip side, which deals with the expenditure to be reimbursed, I presume, from the beginning of the year until the 23rd of July. So that's what I'm trying to understand, because it's a significant sum. And we've only got 4 months of the year left. And it's over $4 million, so I'm trying to understand how that relates to the expenditure up until the 23rd of July.
Mr. Chairman, I'll turn it back to the Accountant General.
Okay. Mr. Tibbetts.
Sorry to put you on the spot, ma'am.
Mr. Chairman, through you, my apologies, the CEO is not familiar with the two-page document that we have distributed. On the first page, you'll see an amount of 4.5 or 4.6 million in regards to staffing costs, supplies, services, and episodic COVID testing. That number may appear to be small, however, we did have some funds that were brought forward from 2020, which helped to offset that. So this is the amount that is still to be reimbursed up until July 23rd, 2021. However, some of the funds have already been spent from previous year's budget to cover the costs.
So, Mr. Chairman, through you, is it possible for you to tell the committee what the overall cost of testing is likely to be at the end of this year for this calendar year?
Mr. Chairman, just to clarify, is it the number just for July to December or for the full year that the member would like?
Mr. Chairman, what I'm trying to get at is really is how does the budget for the next 4 months compare with the expenditure over the last 8 months? That's only 1 month more anyhow. So. Yeah, that's 23rd of July.
24th of July. So.
Yeah. We are at the end of August now, so it's 1 more month.
Mr. Chairman, while I don't have the full amount of information for the 2021 year, I have March until July. and that figure for episodic testing is 2.5 million. So we would have January and February that would be missing from that.
Okay, Mr. Chairman.
Mr. Chairman.
Member for Georgetown Central.
Thank you, Mr. Chairman. Forgive me, I know we haven't had the luxury of hearing from the finance team yet about the whole listing. But there is one part I obviously must have missed. It was this maintenance for dogs. Can you tell me a little bit about that, please? Under the Travel Cayman costings of 3.8 million, I see that we have a 65 for maintenance of dogs. Maybe I've missed the policy position of Travel Cayman for dog maintenance.
Mr. Chairman, I thank the Minister for pointing that out. I've conferred with the Travel Cayman team, and it seems like that may be a misclassification. So apologies for that. We'll look into it and get back to you. Thank you for pointing that out.
I hear my colleagues reminding me of that infamous song, "Who Let the Dogs Out?" Woof, 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 woof. But back to the business of the people. Yeah. Mr. Chairman, I see that there is a allocation of 1.011 million for basic salary. And I asked this question in relation to an area of responsibility that I have, which is Cayman Airways. And I understand that there's a number of the Cayman Airways staff that are assisting, rightfully so, with Travel Cayman, some to the point of 13 staff members. And as the Minister for Cayman Airways, as we ramp up our efforts for reopening, those staff members workload will have to get back to where it's going. And we've been paying the cost for those members for some few months now, which falls under my allocation. So I don't think that this basic salary should actually be a lot more rather than it coming from my budget if it's going to be under Travel Cayman. So at the end of the day, it's all the people's money, and it would come out anyway. My point is, as we move forward to reopening Cayman Airways staff members, either one going to have to rehire some people, or is there an intention for those persons to go back to Cayman Airways because I need my whole work complement for Cayman Airways to be efficient?
Mr. Chairman, I'd like to thank the Minister for the question. I'm going to ask Chief Officer Howell to speak to that, as he's in charge of Travel Cayman. He can help with that explanation.
Mr. Chairman, I don't mind listening to the evidence being given, but I would say, sir, that it is highly irregular for a minister to be questioning another minister in Finance Committee, because with the,
Mr. Chairperson,
with the greatest of respect, sir, you are the chairman and you are the Minister of Finance. And what is happening here now is an inquisition of your ministry by your fellow minister.
Mr. Chairman, yourself and myself sat over there for 4 years. And if the elected member for Red Bay wants me to go get the Hansards and the YouTube videos to show where he had ministers asking questions, I'm happy to do so. Now, for the interests of the park administration, where transparency is key, it is important that we do the public's business in the public, as we are doing now. So there's nothing wrong for us to have this conversation, for me to ask my colleague. Maybe he operated differently with his administration, but that's why he's in the opposition now. So, I
So,
would
sorry,
ask him,
guys, we're getting off track now. The question is on the floor. Chief Officer Oil, before answering, can you state your full name and title for the record, please? Thank you.
Thank you, Mr. Chairman. Wesley Howell, Chief Officer for the Ministry of Border Control and Labour. Mr. Chairman, through you, the budget through to July 23rd is $1,011,000 and some change. That is the cost to date, less some of the staff members who were seconded from other agencies who are paying that salary. The projected cost going forward to year end is 2.4 million, and that includes the additional staff necessary to ramp up for the redeployment of the Cayman area staff back in the Cayman areas and to keep up with the expected demands as we go forward with the reopening plans.
Honorable Leader of the Opposition.
Yes, sir. So just for clarity's sake, through you to the Chief Officer, the Cayman Airways staff that have been working with within travel time, we are picking up that is central government picking up their salaries, and it's not being borne by Cayman Air. Are we reimbursing? How is that working?
Thank you, Mr. Chairman. The Cayman Airways is actually footing the cost now for the staff members. I think it's 13 staff members that are doing the travel support aspect of Travel Cayman. We are in discussions with Cayman Airways about them returning gracefully to Cayman Airways, and we're backfilling for them with additional staff within Travel Cayman as Cayman Airways' demand picks up and they require those staff members back. So to answer the original question more specifically, the funding from July 24th through to the end of the year includes costs for funding those staff members whose costs are now being borne by Cayman Airways.
Okay.
Honorable Leader of the Opposition.
Thank you, sir. To the Chief again. So with the Cayman Airways staff then transitioning back into their former roles, will that create a need for new hiring in Travel Cayman, or are we able to source the staff internally within central government to do so?
Mr. Chairman, we've budgeted for worst case scenario, and that is to hire additional staff members, as has been our practice throughout the whole COVID response, where we can find available staff who are not fully employed in their day-to-day operations. We utilize them, but as we get busier as a country, the necessity to hire additional staff members to keep up with the growing demand in travel as we reopen will cause some new hiring, and that's reflected in the cost of personnel projected through the end of the year.
Honorable Member for Georgetown North.
Thank you, Mr. Chairman. Mr. Chairman, my question relates to the item under the 24th of July 2021 to the 31st of December 2021 for the amount of $367,125 for transportation, i.e. taxi. What category of persons are we still providing transport for, free transport from the airport? And is this something that we intend to continue once the borders are open?
Chief Officer.
Thank you, Mr. Chairman. And to answer the member, so all arriving persons are provided with secure transportation, which the government currently covers those costs. So for persons going to hotels for quarantine, we use buses, and for individuals going to homes, taxis are being utilized for that. The policy around what government pays in relation to these costs, including PCR testing, are all being debated now in relation to, as we reopen and more persons are traveling for leisure, is this a cost that government ought to be bearing? So those recommendations will be considered and going forward from the program board into caucus and cabinet for consideration. But we budgeted for worst case scenario, with the expectation that these costs won't be exceeded, because we would have some savings if we are successful in getting some policy changes around who pays for these expenses going forward.
Honorable Member Georgetown North.
Thank you for that. And the next question has to do with this, the line item immediate bill, that $635,000 for decontamination. Again, I suppose your response would be the same, that you're budgeting for worst case scenario, but hopefully the funds won't be spent. My second question is, how many companies are carrying out this decontamination? And how many companies are carrying out this decontamination?
Chief Officer.
Thank you, Mr. Chairman. Mr. Chairman, there's only one company that's doing that decontamination, and that now is of the vehicles that are used to transport the persons coming in from the airport. That is something that we're actively looking at the program board, and are in discussions with Dr. Lee on what options we can have in relation to decontamination. But again, that's worst case budgeting, but we absolutely don't expect to be carrying that level of cost going forward.
Honorable Member Georgetown North.
Thank you. I think a budget item or a line item of that size is something that probably should go out to public tender. Notwithstanding that, the idea of having every taxi decontaminated once the borders begin to open, as there's further international flights being introduced this month already, or is it a month yet? Yeah. Yeah, so I can't see how that would be feasible, but again, I'll take your word that you're budgeting for worst case scenario.
Honorable Leader of Opposition.
If I can just pick up from where he left off, right below that number, Chief Officer, the $300,000 in technology solutions. What sort of solutions are we procuring?
Mr. Chairman, the technology that we're utilizing now for travel Cayman, where persons apply for permission to travel, has to be modified and adapted for future state, taking into consideration vaccination status and other things on an increased volume. So a lot of that work now is being done manually, which is unsustainable. So we have some funding in there for enhancing the technology so we can automate some of those things, in vaccine verification being the key one that we need to solve in the coming weeks.
Member for Georgetown North.
Yeah, just going to the last item on the 24th of July to the 31st of December 2021, just over $4 million for quarantine facility operating cost. Who are we still covering the cost of quarantine for?
Mr. Chairman, we are covering the cost for essential travel, medical students, persons traveling for government work that is essential at this time. Those costs were quite high during the summer because we expected lots of movement back and forth with students, particularly those going to the U.S., because then also involved going to Jamaica for their student visa applications. But we are actively moving to reduce our room stock now in relation to going forward, recognizing that the essential travel will start to taper off now that the school students are moving back and forth is tapering off. So again, that funding is there, but we don't expect to hit those numbers, given that persons traveling for leisure, work permit holders and others are paying their own way.
Yeah, and I thank you for that, Chief Officer. And as we move forward, based on the government's plans for reopening, you're not going to have that quarantine. I mean, only those who are unvaccinated would require quarantining, and we hope that those numbers are minimal. So we should be down to a 5-day quarantine now, and in a few weeks we should be down to no quarantine. So hopefully the government can save a huge chunk of that. It's $4.3 million. That's a lot of money.
Mr. Chairman, if I put some context into the costing, as per our reopening plan, persons will still be required to quarantine up until October 14th, which is the 4th month of the second half, at least up till the 14th. And there will still be some people who will have to quarantine after that may be not vaccinated, that will fall within the requirement as per the government's policy. And as the chief officer had said, majority of the bulk of this money was accumulated over the summer period, the peak period up until school started. Hence the reason it may look like a shorter period of time has taken up almost the same amount of time for a 6-month period, but it's quite like our revenues for financial services where there's peak months. And we've just, as September has started and school has started back, most of those quarantining options will start to deplete. But the highest bulk of it was in the month of July and August, where kids were traveling with family to get themselves off for school. And there will always continue to be a steady supply, unfortunately, of persons that are Caymanian who have to go overseas for medical cost. So the estimates actually would be appropriate if you look at it from that perspective.
Honourable Member for Georgetown North.
Thank you, Mr. Chairman. I thank the member for that detailed explanation, but this figure of 4.39 is from the 24th of July forward to 31st of December, so has nothing to do with summer travel, but I thank you for the explanation on the but you said that the bulk of-
Is there a question somewhere inside?
No, I just thanked him, but I
you.
do have a question or a request. I haven't heard today, Mr. Chairman, the expenditure to be reimbursed as at 23rd of July 2021. I don't think that's not from January 1st to. So all of these expenses were from January 1st, or just when monies ran out? I suspect it is. Okay, so it's just when monies ran out. I would ask that if possible, I don't need it today, but if possible, if we could get the time periods on these amounts, I would really appreciate it for the records.
Definitely organize for each member to be given a detailed breakdown month by month and actual versus forecasted till the year end. So at least you can put some meat around this, because you're right, this is a large sums of money. And this is ultimately something that we have to all take very serious, because this is not a small amount of money.
Thank you, Mr. Chairman, because it was very difficult to look at these figures that we're reimbursing to get an idea of what we're projecting. And whilst I have complete faith in our civil service, I'd still like to have it for my records.
I can assure you, Honourable Member Georgetown North, we went through the same process. And one thing I did make clear is one thing to get the money voted on, is the next thing to even get approval to spend it. Because it means that we'll be, part of the policy that we're looking at right now is that everything related to OE 140, which covers this, is something that will be passing my desk from that standpoint, because we want to be looking at every single cost, because it is a substantial amount of money. And of course, there was never an original budget for it, so there was no assumption used. So that's one of the things that we are looking at. So many of the questions and observation here today are actually valid, and what we would expect from any person who is in charge of managing the people's money.
Thank you, Mr. Chairman.
Any other questions? Thank you very much. I'll now put it to the vote. All those in favor of OE 140 COVID-19 response and recovery in the amount of $28,477,315, please say aye.
Aye.
Those against, no. The ayes have it. Honorable colleagues, that actually concludes the last item that we have on the agenda. I'm going to just ask members to stick around, and we just say we can maybe, yeah, till about 2:30. We just convene the large committee room to just sign off the actual report, finance committee of the proceedings to their finance committee. So just meet in the large committee room. So as of now, we're suspended until 2:30. Thank you.